So I'm Neil Paragos. I'll be doing my CIA. So my number is 3023-698, section A01 X04. I will now proceed. Knock knock. Applying hand hygiene. Hello, my name is Neil. I'll be your nurse for today. And first off, I'm gonna provide privacy for my patient. And as I do that, I'm gonna go to the side of the bed and I'm gonna raise the bed on my working height position and then lower the side rail. And before I do my two identifiers for my patient, I'm gonna apply some hand hygiene again. Now I'll proceed to do my two identifiers, which is the name and date of birth. So first off, apply hand hygiene, and then I'm gonna ask the patient, can I have your wrist, please? Yes, you may. And can I get your name, please? My name is Mr. Tom Ford. Okay, good. And Mr. Ford, what's your date of birth? June 24, 1938. Okay. Now that I have identified my patient, I'm gonna ask for his level of consciousness. So, Mr. Ford, do you know where you are? Yes, I'm in the hospital. Do you know what's the time right now? It's 2 o'clock. And do you know what's the date today? It's June 18th, 2020. And do you remember what's my name and what's my role? You're Neil and you're my student, you're my nurse. So the patient is alert and oriented to person, place, time, and self. Now I'm gonna ask him about his medications. Mr. Ford, take any medications at all? Such as over-the-counter drugs, prescriptions, pain relievers, or anything like that? No, I don't. And I will now ask for his allergies. And are you allergic to anything such as medication, environment, food? If so, what are your reaction? Yes, I'm allergic to penicillin and tend to have itchy and redness on skin. And now that I have asked his about his allergies, I'm gonna do his vital signs. So first off, I'm gonna do his pulse. So his pulse is I'm gonna get his pulse first. So I'm gonna apply hand hygiene. Can I touch you? Yes, sure. So Mr. Ford, I'm gonna get your pulse. I'm gonna do your vitals first. So now I'll be doing your pulse. Do you recommend which arm you would like me to do it on? No, I don't recommend. I don't mind. So I'm gonna do his pulse, into his left. I'm gonna count for 1 minute. Okay, and as I'm doing that, I'm also looking for his respiration. So his pulse is 98 beats per minute, and it is within normal. And is within normal range of 60 to 100 beats per minute. Is regular and strong, and his respiration is deep and non-labored, and it is 18 beats per minute. And now I will proceed to do his O2 sat. So his O2 sat, I'm gonna have a clamp here. Put it in his hand. So Mr. Ford, I'm gonna I'm gonna collect your O2 sat. Is that okay? So here is a clamp device. It doesn't hurt. It will only take seconds. If you feel any pain or discomfort, just let me know and I'll stop the procedure. Beep. Okay. His O2 sat is 98%. It is within normal range of 95 to 100%. Now that I have done that, I'll be getting his temperature. So his temperature, I will be doing orally. So we have a template down here. We're gonna put it in his mouth. So before that, I'm gonna apply some gloves, and then I'm gonna put in his, and instruct him to say ah ah. And the reading here is around 37.3. 37.3, and his reading is about 37.3 degrees Celsius. And now I'll be doing his blood pressure. So I'm gonna dispose my gloves by hand hygiene again, and I'm gonna get my cuff. And as I get my cuff, I'm gonna ask him, do you prefer on which arm you'd like me to do it on? And he will say, no, I don't mind. And I will also say that if you feel any discomfort or pain or tightness on the cuff, just let me know and I'll stop the procedure. Okay. Now that I have collected his blood pressure is around 130 over 130 over 80, and it's a little bit higher than the normal range, because the normal range is around 120 of systole and diastole of 90. Okay, so now I've done the vital signs. I will now begin his pain assessment, OPQRCV. So, Mr. Ford, when did it start? It started 30 minutes ago when I got stung by a bee. And does it radiate anywhere at all? No, it doesn't. And he will say, no, it doesn't radiate anywhere, but it's it's only in my left arm. And how would you scale your pain from zero? So from zero, from being no pain, from 10 being the most painful, it's around 2 out of 10. Okay. And what does the pain feels like? Now it feels like stinging, and stinging sensation, and it feels itchy. Okay, now that I have done that, I'll do my skin assessment. So for my skin assessment, I'm gonna inspect, and I'm also and as I inspect for the skin, I'm inspecting for any redness, irritation on the skin, bumps, lesions, any of that, and masses. And as I'm inspecting the skin, I'm inspecting his arm. So I'm gonna say to Mr. Ford, so Mr. Ford, is it okay if I inspect your arm for a second? Yes. And he will give me his arm to me, and I'm inspecting for no redness itchiness. I'm inspecting for redness, itchiness, masses, lesions, and any of that. And so far there is a dime-sized bump into his left arm, and it's red, and it looks like it's irritated. Okay. Now that I've inspected his skin, I'll tell Mr. Ford that I'll be right back to get everything that I need. So Mr. Ford, I'll be right back to get everything that I need and able for us to proceed. So if you need any help, just let us know. The call bell is here into your right side. Just press that and any nurse will come for you. So now I will lower the bed to the lowest position, side roll up, and then I'm gonna leave the privacy on for Mr. Ford. Now I'll be going to my med cart. So here is our med cart. So first off, I'm gonna sign in. With this sheet. So last name, first name, signature, and initial. And I've done that here. And then now I'll put this away, and I'll do some verifications between my doctor's order and my MAR. So first off, we are here our doctor's order and our MAR. So patient ID 4545, patient ID 4545, patient's name Mr. Tom Ford, date of birth 24th of June 1938, 24th of June 1938, Dr. R. Brown. Now that I have verified my patient, I'm gonna verify the medication that is being prescribed to Mr. Ford. But first off, I forgot to mention something, that before I enter the med room, I'm supposed to apply hand hygiene before I even touch all this. So I applied hand hygiene and then sign my name, and then verifying my comparing my doctor's order and my MAR. So now I'll verify the medication. So he is being given, in the doctor's order, he's being given Benadryl here. And the MAR, Benadryl, 25 grams orally, every 4 hours as needed. And also he has another drug. He's another medication, Bactroban, 2% ointment. Ointment topical 3 times a day as needed. Okay, now that I have verified my medication, I will now proceed to do my first check. So as I'm gonna do my first check. So first off, I'm gonna do the Bactroban first. Oh, sorry, the Benadryl. So here I'm gonna pull out my Benadryl on my med cart, and we have our Benadryl here. And so I'm gonna go to my MAR and compare it with my medication. And also, I forgot to mention that Mr. Brown also mentioned that he's allergic to penicillin. His allergy, which we put in this sheet right here. So his allergy is penicillin, and his reaction is a rash. And okay, good. So now, doing my check, my first check. So we got here, it's a Benadryl, 25 milligrams orally, and here we got 25 milligrams orally, but and here we got 12.5 milligrams per 5 milliliters, and every 4 hours as needed. And we're also looking the expiration date on here. So since there's 25 milligrams or more, it is going to be 25 milligrams is 10 millimeters. Here on the Benadryl it says 12.5 milligrams, and it is 5 millimeters. Okay, now that I have checked my medication, I will now proceed to do my second check. So my second check, well, before I move on to my second check, I have here is my cup, and I'm gonna pour 10. So first off, I'm gonna calculate on how much I will pour. So it's gonna be 25 milligrams. 25 milligrams divided by 12.5 milligrams, and multiplied up by 5 millimeters, and we got 10 millimeters. So 25, I already did the math, so it's right here. And now that I have done that, I will now pour 10 millimeters on here, eye to eye. So I'm gonna open this, and I'm gonna pour eye to eye on the cup. Okay, now that I have poured it, we have 10 millimeters here. I will now label it. So I will now label with my name, with the patient's name, Tom Ford, initial, dosage,